had said, my name is Amber, and I've worked with her in the ER, and she was actually my instructor for when I went to school for my RN. I'm going to M-State, or the University of Minnesota, Moorhead, for my bachelor's right now, and I'm looking at going on from that. So I appreciate you guys taking your time to listen to my 6-minute speech. All right. Would it surprise you to learn that there is a disease out there that kills more Americans than breast cancer, and is the 8th leading cause of death in the United States? This disease, unlike cancer, has a vaccine available that can help protect you and your family. The disease to which I'm referring to is influenza, also known as the flu. Working as an RN in the emergency department, I see and hear firsthand the many misconceptions and assumptions there are out there about influenza. As a healthcare provider, I feel very strongly that influenza is not talked about in our community at all, and the awareness is very minimal. There are many misconceptions out there regarding influenza in the community as well as in the healthcare population. My goal here today is to make you more informed about influenza, what it is, how it's treated, how to stop the spread, and that there are vaccines available. What is influenza? According to the CDC, influenza is defined as a contagious respiratory illness that affects the nose, throat, and lungs, so basically your respiratory system. Influenza is not vomiting and diarrhea. That is gastroenteritis. That's probably the biggest misconception out there. I hear it every day. I have the flu. I'm throwing up. I have diarrhea. Influenza is usually characterized by a high fever, body aches, headache, and fatigue. Many of these are also symptoms of the common cold, but with influenza, the symptoms last longer, approximately 7 to 14 days, and the symptoms are more severe. Now that we know what influenza is exactly, let's talk about how influenza is spread. Influenza is spread by tiny droplets sprayed into the air when an infected person coughs, sneezes, or even talks. You can get sick from these droplets if they land on your nose, mouth, or eyes, basically any of your mucous membranes. You can also get the flu by touching a surface like a table, doorknob, shopping cart that has the virus on it, and then by touching your nose or mouth. Now that we know how the flu is spread, let's find out what we can do to prevent spreading it. The #1 way to prevent the spread of influenza is by getting vaccinated. This does not guarantee 100% immunity or protection, but it does decrease your chances of getting influenza by 70%. The second, wash your hands. You're going to hear that throughout your nursing career, to wash your hands, because it does help prevent the spread of just about any illness. And stay home if you're sick. We all know how much we feel guilty because we don't want to miss work. We don't want to make our coworkers work extra, but really the best thing we can do is just stay home. Now that we learned that there's a vaccine available, let's learn about some of the facts in regard to the vaccine and all of the myths that we hear about it. What vaccines are available? There are 3 different types of influenza vaccines available right now. One is an IM injection, or intramuscular, nasal spray, or flu mist, and in 2011 they came out with an intradermal injection. We're not going to talk much about that because it really is hardly used in this area, and it did just come out. So we're going to focus on the IM and the nasal spray vaccines. The intramuscular vaccine is an inactivated vaccine, which means it is a killed virus. So you cannot get influenza from a killed virus. This is approved for people 6 months of age and older, and is intended for healthy people, people that are chronically ill, and pregnant women. Next is the nasal spray or flu mist. This is made with a live weakened flu virus in it, which means that it's a live attenuated influenza vaccine. This again does not cause the flu. This is approved for people ages 2 to 49 and that are not pregnant because of it being a live weakened vaccine. Who should not get the vaccine? Anybody under 6 months of age, anybody with a severe allergy to eggs, anybody that's had a severe reaction to the vaccine in the past, and anybody who is ill with a fever should wait until they are symptom-free to get vaccinated. And of course, always check with your healthcare provider to see if it's right for you. All right, so in conclusion, as a healthcare provider, I do everything that I can to keep myself, my family, and my information help to clear up any misconceptions about influenza and the vaccines available. I hope that you can go out and inform others about what influenza is, its symptoms, how it's spread, and how to prevent it. People usually think of influenza as a pretty benign illness. In fact, though, it causes secondary infections and can actually cause death due to the secondary infections. Now that you know the facts about influenza, I hope that you can go out and make a more informed decision whether or not you want to get vaccinated and help educate your community. I do have a handout on IM injections that I'm going to pass out. You guys can throw it away, you can do whatever you want with it when you're done. But it's how to administer an IM injection and vaccines, what ages, what size needles, and so on. So, thanks for your time. I appreciate it. Good luck.